So before coming to CHLA, I was the chief of perioperative and procedural areas at the VA here in LA. So I had oversight of the ORs, all the procedural areas, including cath lab and IR and endoscopy units. Immediately prior to that, I was in New York City at Mount Sinai, where I oversaw the perioperative services in one of their ambulatory locations in downtown Manhattan. And I've held several perioperative leadership positions in different academic medical centers, including Keck Medicine at USC, UC Irvine, UCLA, and Cedars-Sinai. So I've stayed within the academic medical center kind of like realm, and all of those were in perioperative services or in surgical services. Lean or Lean Six Sigma, the process improvement framework or philosophy, methodology that they've used. So I've actually had different versions of lean training from those organizations. But yeah, I've received training at UCLA, at USC, and then at Mount Sinai. And I've actually served as an instructor, at the VA and also at Mount Sinai for those white belt lean training courses. So lean, it's a philosophy, right? It's a methodology that's not one of those like one and done trainings and you move on, and you have to embrace it. And I think throughout my career, it's a guiding principle, that I've really tried to embody when it comes to process improvement, when it comes to just looking at things where, it doesn't have to be a major project every single time, but even just from a perspective of how can we make things better? How can we, find opportunities, to innovate or evolve a process that can, again, impact a small portion of your operations, or it could be, a major process that's really driving your operation. So I think embracing it like that, really helps with just having that process improvement mindset. And I think from an organizational and culture standpoint, when you have lean as a framework, you tend to gravitate away from, that blame culture, that punitive culture, and really look for areas where is it a systemic problem? Is it a product of a broken process? And you see things more from a big picture kind of like standpoint. Yeah, I think in today's healthcare, we often see inefficiencies and waste in so many different areas, ranging from, overstocking or excess inventory to those situations where things are out of sight, out of mind. You don't have good visibility, of those items. And I think with BlueBin implementing, the 2-bin Kanban system, using analytics to really create data-driven decisions, have been very, very helpful. And then trying to really implement point of views into our supply chain process really are the areas of our supply chain that BlueBin has helped us. I think prior to our setup, where we have good visibility of supplies, we run into situations where there are items that we didn't even know we had, right? Because we didn't have visibility over them. And I think having visibility, having realistic part levels established, through BlueBin have helped us. I don't think we have fully eliminated, those issues, but we have certainly gone a long way from when we started implementing BlueBin into the different areas, of perioperative services. We face challenges related to inventory management, stockouts, inefficient replenishment processes. Like what I shared earlier, there were situations where, items needed for surgical procedures were not available. And meanwhile, we have overstock of certain items that were not needed or will not be needed at least for the next few days or even weeks. And ultimately these challenges contribute to unsustainable supply costs in the OR. After implementing BlueBin solutions in some of the peri-op areas, including some parts of the OR, there were some significant improvements in inventory control. We have reduced waste. We've streamlined workflows, which have led to efficiency and some cost savings. And again, in very select areas where we've implemented BlueBin. So we're hoping to expand those implementations to really maximize the benefits of implementing the system. Some of our early successes include, I mentioned, visibility. So we have real-time visibility into inventory levels and usage, and then we can also validate that through our BlueQ analytics. We also have just-in-time replenishment, right? So when we move the empty bins into the on the top most level of the shelf, and that trigger that visual cue to restock have been really helpful for us. And it's a good segue into the streamlined replenishment process that prior to implementation we were making phone calls, we're sending emails, we're sending text messages, we're physically walking down to materials management to get bins restocked. But now with a 2-bin Kanban system, we're able to address replenishment in a more systematic and methodical way. I mentioned the visibility, the high visibility. That's definitely one of the many benefits that's standing out to many. I think from an end user standpoint, the different folks that have provided feedback to us have shared the visibility benefit. The enhanced inventory control. I think now we have, I mentioned data-driven decisions, but to make those decisions, you have to look at the data. And I think, having access to that data, having a deeper understanding, what's contributing, to either an excessive inventory or, subpar, inventory have helped us tremendously. Reduced stockouts, streamlined workflows. One of the things that we're hoping to accomplish once we've fully implemented is to really repurpose, available, bandwidth from the folks who support our supply chain, and then also from our clinical staff. I think at the end of the day, and I know BlueBin and your leaders and your team really pride yourselves in helping clinicians gain clinical time, patient care time, and not have to worry about supplies. I think ultimately when we're able to accomplish that completely, that's going to be one of the major benefits of having BlueBin, as our supply chain system and partner. We have clinical data, tools that will help us with, patient safety and quality. I think ultimately our goal is to utilize those tools and complement each other. So now we're understanding what's on our shelves, and then we're going to have analytics on what we want to add to our shelves, and then we're going to have analytics tools on patient safety and quality. So I think once we're fully implemented in those areas, we can find that synergy and utilize those tools ultimately to provide that best patient care we can offer to the kids and the populations that we serve. So that's kind of like the long-term broader goal with really fully integrating all of our analytics tools within the organization. We regularly communicate with our peers through our Children's Hospital Association or CHLA forum, and in these forums and events, we share a lot of best practices, a lot of use case experiences, a lot of continuous learning opportunities through workshops, and then just mutual support for some initiatives that similar institutions are also going through. And I think looking at those those institutions as peers, as an alliance, through that CHA collaborative, I think have been very, very helpful. It's one thing to look at fellow pediatric academic institutions as competition, but I think since we don't really directly compete with them, we're more of a support group, to each other, providing resources and information. And one of the many things we always talk about is supply chain. And so many of your clients, your pediatric clients, participate in those CHA forums and events, and we're always, discussing, best practices on how to maximize the solution and where else we can improve. Just like most healthcare institutions, we want to be the model of excellence for providing care, to the populations we serve, specifically for surgical patients, for perioperative services. And we want to characterize that by streamlining, our processes. We want to have a data-driven, decision-making culture. We want to innovate technology, and we want to adopt, new technology, new and emerging technology that we can use to improve our processes and better our systems. And have that culture of continuous improvement. I think when you have that type of culture, that type of mindset, you're always looking for opportunities to be better. And it's not always about, bringing in, a new toy, a new technology, but I think when you could continuously improve and innovate what you currently have, those things could lead sometimes to opportunities to bring in, new technology when you've exhausted everything, with what you already have with your current resources. And I think ultimately, achieve exceptional patient outcomes, as a result of those things, and then translate that, or it would then translate rather, to be that model of excellence, that I'm talking about. So that's really the vision that I have. And I think when you address those things, staff engagement follow, right? Because part of having very engaged staff is making sure that they have, the basic things they need to get the work done. And when they feel that, they have this sense of purpose, a sense of mission, and that sense of belongingness, through that vision, through what we're trying to accomplish collectively, will help us all in our journey towards, operational excellence and enhanced efficiency, and achieving, improved cost savings management for the organization. And I know when you look at it from those perspectives, you're wondering, or one could wonder, where will this patient care come into that? But when you address those things, patient care ultimately, improves, because when you have better efficiency, you have better patient outcomes. So when you have streamlined processes, you have better patient outcomes. When you're able to save cost and reinvest those savings, to patient care, you have better patient outcomes. So I think, addressing those things is very, very important to what we're trying to address, which is the obvious, which is to have the best patient outcomes, for the patients that we take care of.